You cannot shrink your enlarged prostate if you take these 5 medicines. Are you struggling with an enlarged prostate and wondering why your condition isn't improving even with medication? You may be surprised to learn that some common medicines you're taking could be making things worse. That's right. Certain medications are actually contributing to your prostate problems rather than shrinking it. In this video, we'll reveal the top 5 medicines that are preventing you from shrinking your enlarged prostate. If you want to finally see improvement, make sure to watch until the end. Trust me, you don't want to miss number 1. It's something a lot of men take every single day without knowing the side effects. Now let's talk about the symptoms you might be experiencing. Maybe you've noticed difficulty in starting urination, a weak urine stream, or that you're going to the bathroom multiple times during the night. These are all common signs of an enlarged prostate, and they can severely impact your quality of life. If any of this sounds familiar, you'll definitely want to keep watching to find out which medicines might be keeping you from getting better. Ready? Let's dive into the list, starting with number 5. 5. Antihistamines, allergy medications. Antihistamines are a lifesaver when it comes to dealing with seasonal allergies, hay fever, or even the occasional cold, but they could be working against you if you have an enlarged prostate. Here's why. Antihistamines work by blocking the action of histamine, a substance in your body that causes allergy symptoms. While this is great for stopping sneezing and runny noses, antihistamines also affect the muscles in your bladder and prostate. Specifically, they can cause the muscles around the bladder neck to tighten, making it harder to urinate. This tightening effect can aggravate one of the most frustrating symptoms of an enlarged prostate, difficulty in starting urination or a weak urine stream. If you're noticing that it's harder to go to the bathroom or that you're making more trips than usual after taking allergy medications, antihistamines might be the culprit. If you're regularly taking these drugs for seasonal allergies, it's worth discussing alternative treatments with your doctor, especially if prostate issues are a concern. 4. Antidepressants. Mental health is vital, and for many, antidepressants like SSRIs, selective serotonin reuptake inhibitors, can be a lifeline. But here's something many don't know. These medications may interfere with your prostate health. One of the side effects of antidepressants is their ability to relax various muscles in the body, including those in the bladder and prostate. While this muscle relaxation can help with mood regulation, it also makes it difficult for the bladder to contract properly, leading to incomplete bladder emptying. As a result, men who are on antidepressants may experience increased urinary retention, which can lead to frequent bathroom visits, especially during the night. Additionally, not fully emptying the bladder can increase the risk of urinary tract infections, adding more discomfort to an already frustrating situation. If you're on antidepressants and also dealing with prostate issues, it's important to have a conversation with your healthcare provider to see if an adjustment in your treatment is necessary. 3. Diuretics, water pills. Diuretics, also known as water pills, are commonly prescribed to help reduce fluid buildup in your body, particularly for conditions like high blood pressure, heart failure, or kidney problems. These medications work by encouraging your kidneys to flush out excess water and salt through your urine, which helps to lower blood pressure. But while this is beneficial for heart health, it can be a real challenge for men dealing with an enlarged prostate. One of the major symptoms of an enlarged prostate is frequent urination, especially during the night, a condition known as nocturia. Diuretics amplify this problem because they increase the volume of urine your body produces. If you're already struggling with an overactive bladder due to your prostate, diuretics can make it even harder to control. This can lead to constant trips to the bathroom, disrupting your sleep and daily activities. In some cases, diuretics may even worsen urinary retention, where you can't fully empty your bladder. If you're on diuretics, it's crucial to weigh the pros and cons with your doctor to manage both your heart health and prostate health effectively. 2. Decongestants, cold and sinus medications. Decongestants are a popular choice for relieving a stuffy nose or sinus pressure, but if you have an enlarged prostate, these medications could be doing more harm than good. Decongestants, such as pseudoephedrine and phenylephrine, work by narrowing the blood vessels to reduce swelling and congestion in the nasal passages. However, this vasoconstriction doesn't just affect your nose. It also tightens muscles in other parts of your body, including the muscles around the bladder and prostate. For men with an enlarged prostate, this tightening of muscles can worsen symptoms like difficulty starting urination or cause urinary retention, where you can't empty your bladder completely. In severe cases, decongestants can lead to acute urinary retention, a condition where you suddenly cannot urinate at all, which can be very painful and might require emergency medical treatment. So, while decongestants might clear up your cold symptoms, they could be seriously aggravating your prostate issues. Always check with your doctor before taking cold and sinus medications if you have an enlarged prostate. 1. Non-steroidal anti-inflammatory drugs, NSAIDs. And finally, the most important medicine on our list, non-steroidal anti-inflammatory drugs, or NSAIDs. These include commonly used medications like ibuprofen, Advil, aspirin, and naproxen, Aleve, which are often taken for pain relief, inflammation, and fever. While these drugs are effective for short-term relief, studies have shown that long-term use of NSAIDs can increase the risk of urinary problems, especially in men with an enlarged prostate. NSAIDs can interfere with your body's natural ability to maintain proper blood flow to the kidneys and prostate, which can lead to worsening prostate symptoms over time. In particular, they can cause urinary retention, making it harder for you to empty your bladder completely. What makes NSAIDs especially tricky is that they're available over the counter, meaning many men use them daily without realizing the potential risks to their prostate health. If you rely on NSAIDs for chronic pain or inflammation, it's critical to explore safer alternatives with your doctor, especially if you're dealing with an enlarged prostate. Reducing or eliminating NSAIDs from your daily routine could make a significant difference in your prostate health. By understanding the impact these medications have on your enlarged prostate, you can take proactive steps to better manage your condition. Now that you know about the top 5 medicines that could be preventing you from shrinking your enlarged prostate, it's time to take action. If you're currently taking any of these medications, don't stop them immediately, but do have an open conversation with your healthcare provider. Together, you can explore alternatives that won't interfere with your prostate health. Remember, managing an enlarged prostate is not just about treating the symptoms. It's about making sure that the treatments you choose are working with your body, not against it. If this video helped you, don't forget to give it a thumbs up, share it with someone who might be facing the same challenges, and subscribe to Healthy Habitat for more valuable tips on improving your health naturally. Let's continue this journey to better health, and I'll see you in the next video.